This is the Diagnostechs saliva test for hormones. And again, on our summary sheet here, you can go down to Diagnostechs and it's the saliva test. You're going to do this test at home. We're going to follow the test kit instructions here. Anywhere where you see a highlight marker, you have to pay attention to that. So on the front page here, it's required you completed your samples on, and you have to write the date in here that you completed the test. All of these samples have to be done on the same day. You cannot break them up. Also, were the samples refrigerated? They have to be refrigerated, so you're going to check yes. On the back, you're going to see a lot of highlights here. You have to pay attention to all of this. So, 3 to 5 days prior to the collection, all samples, you have to avoid hormone supplements, any sublingual hormones, and then from the night before, you have to avoid sublingual hormones. Do not use antacids, bismuth, which would be Pepto-Bismol, or mouthwash. On the day that you collect, do not eat chocolate, onions, garlic, cabbage, cauliflower, or broccoli. All those instructions are right here. Also, on the day that you collect, do not drink any coffee, tea, or caffeinated beverages. Now, before each one of these samples, for 60 minutes prior, you cannot have anything except water. And then 3 to 5 minutes before each sample, what you're going to do is you're going to rinse your mouth with cold water for 30 seconds, and then 3 minutes later, you're going to do the test. Now, when we're doing the test, what you do is these are all labeled. So there's 4 blue vials. This is your cortisol pattern. So we're going to get a test first thing in the morning, noon, afternoon, and evening. These are all labeled. You're going to want to make sure you get the correct vial. This says morning fasting. As it's labeled on here, you're going to do this between 6 and 8 o'clock in the morning. To do the test, you're simply going to take the top off. You put your mouth over the tube. You have to work up saliva to the top of the sticker. It does take a little bit of time. Be patient with it. If your mouth gets dry, what you want to do is you want to take a drop of lemon juice and put it on your tongue, and that will help produce saliva. So make sure you have lemon juice in your house before you do this test. Once you get enough saliva towards the top, put the top on. Every sample, as soon as it's done, has to go in the refrigerator. We're going to have the label filled out with your name and your date of birth. So once this is done, morning fasting is between 6 and 8 in the morning. The next test is at noon. Make sure you take the vial that says noon on it. Again, make sure 60 minutes before the test you don't ingest anything except water. 3 to 5 minutes before the test, rinse your mouth with cold water for 30 seconds. Then 3 minutes later, take the vial, top comes off, put your mouth over the tube. You're going to spit, work your saliva up to the top of the sticker again. Be patient, it does take time, and use that drop of lemon juice if your mouth gets dry. Top goes on it. Once you're done with this has to go in the refrigerator. The next one is the green top tube. Now this is for your other hormones like estrogen, testosterone, progesterone, pregnenolone. Same thing, 60 minutes before the test, nothing but water. 3 minutes beforehand, rinse your mouth with cold water for 30 seconds. Take the top off, spit in the tube up to the top of the sticker. Top goes on, this goes in the refrigerator. This is done at 2:30. So 6 to 8 in the morning, noon, 2:30. The next one is afternoon. It's labeled. This is going to be done at 5 o'clock. And all these times are listed on the sheet here. Again, tube off. All the instructions we went through, they're all the same. Fill this up to the top of the sticker. When you're done with this has to go in the refrigerator. And finally, the last tube is labeled midnight. This is going to be done between 10 o'clock and midnight. If you are up until midnight, do this at midnight. If you're somebody that goes to bed early and you can't stay up that late, at least stay up until 10 o'clock and do the test. Once this test is done, it's in the refrigerator. Put all of these vials in this plastic bag. That goes in the box, the travel kit, and also you're going to write the date you collected the samples here as well as on the front. Also, there's a fill-in here. They want to know when you had your last meal or snack before each tube to make sure you fasted properly. And then here, please circle if you have gingivitis or bleeding gums. or you're not on a regular wake or sleep cycle. Potentially interfering substances are listed here. If you're taking any of these, make sure you mark that in as well. So all the tubes are in the box. You may have to put the requisition form filled out properly in this box as well. You're going to make sure the box is in the refrigerator overnight, and what you're going to do is fill out your return name and address here. This is shipped UPS. You're going to take this adhesive label, peel it off. You're going to put it right on the box. This will seal the box. This is postage paid. You don't have to pay anything. This is going to be dropped off at UPS the next day after you do your test. Again, there's no charge for this. All you do is drop this off and UPS will deliver it.